in the modern world, the invisible and subjective nature of pain can often frustrate the core way of knowing in medicine, which focuses on identifying pathology. And that opens the doors to ideas of malingering or faking it to get something. In diseases that are poorly understood in their time, like chronic pain, the lack of understanding or ambiguity is usually resolved against those who suffer through the use of stigmatizing metaphors. So stigma is intimately connected to power. It is structural. Obviously, there is a hierarchy within the clinical relationship between the patient and provider, but at the social level, disadvantaged groups are far more likely to suffer from stigma.
You'll find a lot of peer-reviewed publications that includes these kinds of stigmatizing language, describing individuals with sickle cell disease as patients who are difficult, who are hard to reach or non-adherent, or they come from very chaotic family backgrounds, or mistrust doctors and research. And oftentimes when this stigmatizing language is present in research, it is used as a way to help explain away some of the limitations of research study designs, and inevitably ends up placing the blame on the individual with sickle cell disease. And it is really imperative on us to be able to shift and challenge those assumptions and narratives to not what participants need to be doing differently, but what we as researchers need to be doing differently to engage and support them better.
Society tends to associate chronic pain with older adults. However, the prevalence of chronic pain in young folks are between 1 in every 4 to 5 child or adolescent might have a chronic pain condition. We conducted focus groups to truly understand what the experience of pain-related stigma was like in this population. So this example is within the school setting. Sit down, you need to get back to class, stop faking it. And then another characteristic of it just all being a mental health condition. It's because of anxiety, depression, you just have to see a psychiatrist, which undermines the biopsychosocial evaluation and treatment that we know is the best to help individuals with chronic pain.
I want to present to you some words, stigmatizing words that will give you examples. These are pulled from medical records. So these are words that healthcare professionals are writing in the medical chart. Extra important for all of us that are medical professionals nowadays with open notes. All of our clinical notes really are intended to be available for viewing and consumption and use by all patients. It is important to know and to avoid and not use words and phrases that indicate disbelief.
I think it's important that we increase the awareness that pain-related stigma exists. And it might actually influence our health outcomes or the outcomes that we're interested in researching, but then also our recruitment efforts. And as the presenters have already shared, having patient and parent advocates can be very helpful, even from the very beginning. The study design and what are we using in our recruitment scripts can be very important because language is really important. We have to make sure that we're doing person-first language. We're reinforcing that biopsychosocial model, and we're not unintentionally reinforcing that it's either all biomedical or all psychosocial. And especially in our young populations, the use of metaphors to describe what chronic pain is can be very important.
Think about assessing trust in your research as an organization, perhaps the community as well. Use validation of the experience of chronic pain, emphasizing interactions, both verbal and nonverbal, that convey belief. Also think about how you can purposefully integrate this into your training curriculums, individual and perhaps organizational levels with a focus on language, listening, empathy, and again, structuring protocols and procedures to be attentive to the factors that really build those relationships, indicate belief, eliminate, and ultimately with the goal of eliminating stigma.